Hello everyone, this is Dr. Mo with Wink Orthodontics, and we're going to show you a case and how we treatment plan them here at Wink Orthodontics. This dad presented with his son. They weren't sure whether they needed orthodontic treatment or not, and they were referred by the general dentist for an assessment. Looking at their top front teeth, they look great, to be honest with you. I'll show you what I usually look at is the alignment first, and we draw these lines to see how the teeth line up more or less. Honestly, they're not too bad. There's a lot worse, and this is fairly decent. Now, please keep in mind that these are adult teeth. However, these are baby teeth. So this child has, again, these two molars in the back are also adult teeth. So there's 6 baby teeth up top and only 4 adult teeth. They're fairly straight. I took an x-ray and everything seems fine. The canines are coming in nicely. They're not in all the way yet. Obviously, the baby teeth are still there. Let's look at the bottom. It's a very similar situation. And there's a little bit of crowding, not too much. Again, those bottom front teeth, or sorry, bottom back teeth are fairly nicely lined up. They're not too bad. The bottom front teeth, there's a little bit of crowding and overlapping for sure. And then still another 6 baby teeth on the bottom. So there's 12 baby teeth in total. The teeth are fairly straight when you put them together, the top and bottom. You know, the bite is not perfect. They have what's called a deep bite. The top teeth overlap the bottom teeth by a lot. We can barely see the bottom teeth. The bottom teeth are actually hitting on the palate, and you can see that here. I mean, they're hitting the palate, and that's not a good thing. This will cause wear on those bottom adult front teeth, and you can see how heavy those forces are with those red coloring. We want something like this versus something like that. So blue, green, a little bit of yellow or orange is fine, but then the red is heavy occlusal forces. And you can even see that this tooth is kind of getting more flat. There's a little bit of chipping here, but then he's still so young. I will not be able to treat it fully. It is difficult. And I told the parent, hey, you know what? If you want, I can, or you can just wait till all the adult teeth come in and we just get it all done at once instead of doing orthodontic treatment twice. First, while the baby teeth are there and going back in again when the adult teeth come in fully. Parent opted to wait. They got a second opinion and they also told them to wait, and that's what they're going to do. So that's why it's important to keep seeing your orthodontist at early age. So at least you know what's going on. You know if we need to start early or if it can wait. And for this person, they opted to wait. And I think that's what I would have done if they were my son as well.